The vision was to invest in community residents within each Asian subpopulation and build a cadre of community health workers as a trusted network and extension of the healthcare system that would provide outreach and education services, connect and link people to services, and to identify common barriers that could be addressed to improve access to services, all aimed to improve the health outcomes of all Asian populations. The potential of the Asian and Pacific Islander Community Health Worker Program is not only to improve access to needed health resources and the opportunity to provide health educational services on topics specifically needed by each Asian subpopulation. The Asian and Pacific Islander Community Health Worker Program also has the potential to build a network of community advocates and navigators who collectively can work to address barriers to healthcare services and serve as an incredible health and public health workforce pipeline.
Public Health Department has been contracting AACI to make AACI as the lead agency for this current project. AACI has been subcontracting with 7 community-based organizations in order to carry out the work, such as recruiting, training, and deploying community health workers to serve the ethno-specific communities. And AACI also been working with the Public Health Department in order to kind of train as well as recruiting and capacity building for community-based organization and community health worker.
We serve marginalized API populations in the Santa Clara County. We provide evidence-based program, and that is focused on fall prevention, chronic disease management, health promotion, as well as healthy aging perspective. We work with many partners, including Stanford Healthcare, Department of Public Health, as well as Bengal Science in West Kentucky University, to promoting all of these evidence-based programs in specific in Mandarin and Cantonese, supporting our community health workers, staff to receive training. In the 3 years of programming, we're receiving more than 85% of the individual had completed their 75% of the classes. We also can expanding our program to work directly to all of these local low-income housing and bringing our evidence-based program to these housing and engage more senior that are high risk of isolation.
At VAR, we have several initiatives that aim to really bridge the gap between a whole variety of resources for the Vietnamese community living in Santa Clara County, which entails people like youth, the seniors, working adults, people experiencing homelessness, etc. Through the Community Health Worker Program, we've been able to reach various members of the Vietnamese community here in Santa Clara County through things like direct health need resource access, as well as direct health impacts such as vaccinations, mental health workshops, understanding alcohol and drug abuse amongst youth, and more. Our health equity program was very small and very limited, but through AACI, we were able to secure more funding in order to provide more resources like obtaining free COVID-19 items for all the community members, however much they need, and also providing information, training, and resources to help build our community health worker program so it's sustainable and we can take that information that AACI has given us and apply it to different health programs as well. AACI has been very instrumental in giving us the funding, the resources, and the support that we need to do what we do on the ground.
Hey all, my name is Marnelli Canosa, the Health Equity and Outreach Coordinator here at Lead Filipino, the South Bay nonprofit aimed at activating the Fil-Am community through leadership, education, advocacy, and open dialogue. Since June 2023, we've held a total of 9 workshops averaging at around 20 attendees, focusing on topics such as dementia, cardiovascular health, and healthy relationships and open communication. In comparison to our 2022-2023 timeline, we've had 13 workshops focusing on similar topics, averaging at 11 attendees. So there's some growth there. Through our social media outreach, we've reached a total of 3,000 impressions on our Instagram posts and have increased our readers on our newsletter from 230 to 400 readers. Through that, we were able to spread awareness about topics important to our Filipino American community, as well as hire 2 additional interns for our outreach work. Through our in-person outreach efforts, we've reached around 900 community members, have performed around 32 blood pressure checks, and have given out 14 blood pressure checkers.
Located in San Jose's historic Japantown, AACI is a nonprofit senior center with a variety of services for seniors and their families. Our primary service areas include social services, senior daycare, nutrition, and activities. Programming is designed around our Healthy Aging initiative, our mission and vision to promote healthy aging and successful independent living, and to advocate for all seniors while embracing Japanese American tradition, to empower seniors to age well and thrive. Our workshops have reached an average of 35 participants that focus on healthy hearts and healthy eating. We've reached over 18,000 community members through our email blast, which focuses on arthritis, asthma, lung cancer, triple-demic, and other health education materials on healthy hearts.
My name is Keikoa Lopez Pugullo. I also go by Koa. I'm the program manager here at the Regional Pacific Islander Task Force. Building that connection with Sunnyvale Samoan Congregational Christian Church has really kind of been our touch point with the Pacific Islander community in the South Bay. I think that, building that and cultivating that relationship is really kind of why it's been so successful over time. And we didn't really have that trust initially, even though we are Pacific Islander ourselves, like all of our staff are, and we advocate for Pacific Islander equity and health, we can't assume that just because we're Islander, we know how to talk to all Islanders and earn that trust without actually showing face and being that person on a Saturday, The biggest achievement out of the participation in this initiative, this community health worker program, has really been to just train my Pacific Islander colleagues, my staff, on actually giving blood pressure screenings. So, that kind of capacity development out of that AHA, American Heart Association training really kind of allowed us to bring that to health tables. So whenever we go to health fairs or participate in events like that, we actually offer blood pressure screenings now. So it's kind of like a capacity development that we got over time as a result of participating in this program.
Welcome to Vivo. We are here to talk about the Community Health Worker Program. It was born right in the middle of the pandemic, the COVID-19 pandemic. We were there to provide them with the right information. As a result, in Santa Clara County, the Vietnamese American community has one of the highest vaccination rates. But we also talk about different problems in their life, like a chronic disease. Our workers, our staff, receive more training from AACI. We provide the newcomer with many programs, especially in the ESL program, computer class, training class so that they can looking for a new employment in the new country. We provide the citizenship program so that they can learn to prepare for the citizenship exam and to pass the exam.
On the last Friday of the month, we have an event, a lunch called Social Friday. The topic of the seminar was mostly about health, but also mental health, which is an important issue in the community. So it's about time to reflect back and reminisce and share some thoughts about opportunity and challenges.
Hello, I'm Eunice Chun. I'm an Executive Director at Korean American Community Services. So part of a community health worker program, we conducted this evidence-based program called Enhanced Wellness Program. So during this program, our community health worker designed this program to advance their social, physical, and mental improvement by doing different activities like brain exercise, physical exercise, and create space for socializing. So it is so beautiful to see those 80, even 90 seniors come together once a week, learn some activity, and share their challenge or laugh or stories. So it is so beautifully designed. So we are the only Korean ethnic food provider among 40 different sites in Santa Clara County. We are serving over 70 meals per day, and 30% of participants are non-Korean and mostly AAPI seniors. The work we do through community health program or the senior center activity or senior nutrition program, we literally change the lives of seniors and save their lives physically, mentally, and socially.
Sewa International is a Hindu faith-based organization dedicated to serving humanity. We serve humanity irrespective of race, religion, gender, or nationality with the mission of happiness for all. We focus on disaster recovery, family and child welfare, and promote volunteering through various opportunities. We grew in leaps and bounds in 2023. The number of volunteers involved and the projects undertaken almost doubled since last year. 650 volunteers, 22 initiatives, SUA Community Center, 45 partner organizations, and collaboration with public officials from 12 cities and 5 counties made all these projects possible.